Citizens Advisory Group.
Be safe.
You too, Doc.
Safe.
Bye-bye.
7:43. Let's keep it in the KUAM News Zoom room. Joining us via Zoom, but it says she's having some what? Lighting video. Anyway, Dr. Ann Pobutsky.
We still got her on audio, though.
We do have her. Yes, she's there. Doc, good morning.
Morning.
Thanks for joining us.
Sure.
Hi,
What's
Doc.
up?
Are you able to break down the CDC categories for the variants, the three different categories from variant of interest, variant of concern, and variant of high consequence?
Yes, those are the terms that the CDC has used to categorize. As you know, we sent samples to the CDC in January and February. Again, these are samples. They were trying to get a variety of samples. We had some from travelers from the Philippines, some from travelers from other places in the QFAC, as well as local samples. These samples had to meet the criteria for the CDC that the CDC establishes for the sequencing. So out of those 49 samples that we submitted, 26 came back with results the other day, and 7 out of the 26 were variants of concern. They were all the California B1.
I'm sorry, variants of concern or variants of interest?
Maybe I don't know off the top of my head. Hang on.
Okay.
These are variants of concern.
Okay.
Okay. B1429 from California. There's no evidence we have at this time that we have any other variants. We're not seeing anything from Brazil or South Africa or the other variant from California. So that's all we know. We should have another report soon from the other samples that we submitted. The other thing to realize is that this is a process that's been established by the CDC, and we're going to get more and more of these reports because they're on top of doing the molecular sequencing. On the other hand, we hope, we just submitted a grant last week, public health grant to the CDC, where we have requested getting some of these molecular sequencing machines at the lab. So we might be able to be doing this on our own here on Guam in the next 6 months. But in the meantime, we will be submitting samples to CDC and getting these kind of regular reports about what we see here. On the other hand, our numbers are low, so that's good. We don't want to see a surge of anything, but the sampling depends on, what they're collecting and what they're sending to the CDC. So again, it's just a sample.
And just
so we don't have a wastewater surveillance yet. We're trying to do that. We're trying to get a machine to do wastewater surveillance. On the call I was on earlier, Missouri was talking about in their samples, they were only seeing about 7 to 10% of a particular variant in the cases, but they were seeing 30% in their wastewater. So this is just one of many surveillance strategies that we have here in conjunction with the CDC.
Can you explain the wastewater surveillance a little more, Doc?
It's basically what it sounds like. Surveillance of wastewater, where they take samples from the different sewage stations to see what's circulating in the sewage, because people shed virus in their feces. And again, we tried to do this 6 months ago. We didn't have, we weren't organized enough to get it going, but we did submit in this recent grant monies for such machines to monitor the wastewater. Mm-hmm. A lot of other communities are doing this throughout the U.S. And that can be used in the future, not just for COVID or SARS-CoV. Yep.
Back to that, the molecular testing, is that kind of the same as the genomic testing?
I don't know enough about. I assume so. They're testing for the particular gene of the variant.
Genomic sequencing, I mean.
Yes, and I don't know enough about molecular sequencing. You're going to have to get somebody else to talk about that. But basically,
we're trying. We're trying.
Excuse me?
So what did you mean then about this molecular? Did you say molecular testing or molecular sequencing?
Sequencing.
Sequencing. Okay, and that's to help determine the variant?
Yes, the different strains of the virus.
Okay. And you're saying that we might have the ability to do that
In the future.
in the future.
Yes, in the future.
Okay.
If they approve the budget and everything for that, for wastewater.
So for
And
this,
of course, at the time, we still do molecular, that we're sending our samples to the CDC.
and so you said that we sent some from February, but the results and the findings that we were told about during the press conference yesterday, as I understand, I thought it was just for just from January. So we're still waiting for February, and just
Right. But given what we know about Guam and our travelers here, I don't know if we'd expect to see Brazil or South Africa. It's what we expected to see. We get a lot of travel here from California and from the U.S., the continental U.S. So I'm more interested in seeing what the sequencing results are for the samples from the Philippine travelers.
Doc, I remember when we had, back when Dr. Cabrera was coming on, we had him on and he had said that they also sent samples from the second surge. Do you know anything about those? Because I'm looking at the press conference and it says they received results from 26 of 49 samples.
Yes. And the question is, I do not know. I just know that what we submitted was January and February. They do have samples in the freezers. Those samples might not have met the criteria for submitting to CDC. They have some stuff that's stored in the freezer. I suggest you get Anne Marie Santos from the Public Health Lab to come on and talk about that.
And so this B1, this California variant, I'm just looking at the CDC website. It says 20% increased transmissibility, significant impact on neutralization by some but not all EUA therapeutics, moderate reduction in neutralization using convalescent and post-vaccination sera. Can you explain what that means?
No.
Oh. Okay.
Not without getting it wrong. We just know that this particular variant, yes, it says increased transmissibility, and that's pretty much it. But we do know that the vaccine seems to work against this particular variant.
There was something
I don't know. I do not know enough about how that works. You're going to have to talk to an MD or a biochemist or somebody like that.
Okay. Yeah, because I think during the press conference, it was maybe Dr. Mike Cruz and even Dr. Cabrera were talking about like Bamlani, VMOB,
yeah,
and some of the Remdesivir.
Yeah, Doc, let me just ask, 'cause, you know, I mean, most of the people talking about this press conference yesterday and this new information about these samples are coming away with the takeaway that doesn't even matter because we're getting told that, oh, we've got this variant here that's way more transmissible, it's very catching, but we just don't have the numbers to support that conclusion. So people are kind of like, oh, okay, and, you know, I mean, meanwhile, we're marching forward. So would you agree that that is the takeaway from this press conference, is that, yeah, we have the variants, but it's not a big deal?
Yeah, and again, we need to vaccinate our population because we know that the vaccines provide protection from these, from very severe sickness. So that's why we're moving to vaccinate everybody and get to herd immunity, because vaccines offer some protection anyway. What we don't want to see is people dying and going into the hospital and that sort of thing.
Right.
So and I don't know enough about the details of how the vaccine works and how it works on the different variants. You're going to have to get someone else to come on and talk about that. But we do know that the vaccine offers protection, some protection, and it's probably it's better to get vaccinated because then you're less at risk for severe illness, even if you get infected.
Right. No, I agree. That's the plan. We have to protect ourselves. We have to get vaccinated, and we should be racing to get the vaccine. But I just for me, I just wanted to know more information about, you know, what is this new variant.
Yeah, I guess
just so I know.
Yeah.
You know, what are the different levels? You know, the variant of interest, the variant of concern, and the variants of high consequence. just so people are
Well, the ones
informed.
of high concern are the ones that are coming out of other places like Brazil and South Africa, and because they're produce more severe illness. I suggest if you really want to know the details about that, you can get a virologist to come on.
Mm-hmm. Okay.
Okay.
Yeah, I mean, well, it
Well, do you
would be
guys
nice
have
to
a-
have like the Surgeon Cell or Dr.
Yeah.
Felix Cabrera as well on, since they were speaking at the press conference. But Dr. Cabrera refuses to come back on the show. So, hello, Dr. Cabrera. We'd like you on the show to kind of break down this information that you threw out at the press conference. Anyway.
Well, I'm sure he's busy. I'm sure you can ask him. He's really busy. I see that.
Yeah.
He's crazy busy.
Yeah.
We're all still busy.
Well, thank you for
Even though
your
the-
time, Doc.
Catch up.
I guess from an epidemiologist standpoint, what can you tell us about the variant and its impact on Guam?
That seems to be Guam's okay. We might have this California variant, but it's a variant of concern. It's not a variant of high concern. And I think we're in good shape right now as long as we keep vaccinating everybody and we keep these kind of travel restrictions, because our biggest problem has always been people bringing it in. Again, out of the 7 samples, 3 were travelers, 4 were people who were local, but we don't know if they had travel or not. I think some of those samples came from mass screening.
Mm-hmm.
We have no known travel.
Right, that's where they
Among
said
those.
the community.
Right.
Spread, yeah.
And this is a small sample. It's a small sample of what's going on. And we should get another report soon. And hopefully we'll be able to do this on our own, not just for SARS-CoV, but for other stuff in the future to do molecular sequencing of variants of concern of other diseases.
Right on.
All right, thanks.
Thanks, Doc.
Doc. We'll try and get that virologist or...
Virologist. Do you guys have a virologist?
I don't think so.
Oh, okay. Now calling all I'm gonna shoot a bat signal up for. Well, let us know if you get one.
Yeah, right.
Yeah, I wanted to follow up on something. You know, the Joint Information Center, they had pushed out a release a couple weeks ago regarding, they had changed the number of COVID casualties. I think it was bumped up by 2 because there was some, research or something being conducted, or reviews of the COVID or fatalities or deaths or something like that.
Yeah.
Do you have any information about that
Yes.
evaluation and
Yes.
why?
Yes. As the numbers grew lower, we decided to do a death review, which is review of all the death certificates from all of the COVID-related deaths. And we found that some had not listed COVID as a cause of death. And so we asked the various people involved. Sometimes it's the medical examiner or the hospital pathologist or another MD who was on the case to reevaluate and reassess based on the more complete information we have gotten. Sometimes the medical examiner doesn't get all the hospital and MD notes. And sometimes the hospital people aren't apprised of, say, a diagnosis that somebody might have had that when they went into the hospital. So we basically did a death review, and we still have 2 cases under review.
Right.
And that's what bumped up our numbers slightly. And it might bump up again. We're still waiting on the last 2 cases, and that'll bring us up to date on a death review. This is very common to do this sort of thing. And death certificates are amended all the time, depending on new information that people get.
Correct. Doc, I wanted to ask, because there was a story that I had covered, I want to say in the early part of the pandemic, a 10-year-old boy whose death certificate had listed, what is that condition, Bree? It's a COVID condition. It's
MISC.
right.
Multi-inflammatory syndrome.
And so this 10-year-old boy that was listed as the cause of death on his death certificate, and it was also, I think, a determination made by Dr. who comes on this show a lot. And then later, the determination had been made that, he didn't die from that, and they had changed it. And so when I was looking into it, the response I got was, like you had said, that happens all the time. They change the death certificate, and it's, totally normal. So is that particular case being reviewed, Doc?
That case was viewed a long time ago, and I believe it was determined not to be MISC because I don't know the details off the top of my head, but there was that was reviewed early on because it was a case that was concerning.
Right.
No, these more recent cases are within the last several months.
Okay.
And I believe that was older in the fall that did not have COVID-19 listed, but it was being counted as a case already.
You know what?
Sometimes it takes a while to get the death certificates too. Sometimes it takes weeks and months to get death certificates. So we really don't know. And no, I don't think death certificates are amended all the time, but it does happen. It's common. It's not 9 out of 10. You know, it's more like 1 out of 10 maybe or less. But it does happen.
What about
That's normal.
What about deaths prior to the public health emergency declaration? Are we looking at any, because you've seen this in other jurisdictions where they start looking at deaths before the pandemic. It's like, oh my God, people were dying of COVID before we even knew about the COVID. Is there any review planned for maybe deaths in January, February, March time frame of 2020?
We are examining all the deaths from 2020. We are just doing an assessment, and we're coding the data and everything. Yes, we are looking at that.
Okay. You good, Bree? Thank you, Doc. Appreciate
Thanks,
your
Doc.
time. I know you're very busy, so we value every second.
If you want the specific expert, get the specific expert.
All right.
Thank you. Okay, I just want to address this specific expert stuff for you guys. Always try and be as open and transparent as we can. But I feel like there's a certain obligation, a certain responsibility from the Department of Public Health and Social Services to provide information